Good morning, Mark. Good morning, Whitney. Well, the FCC has unanimously voted to designate 988 as the new national suicide prevention hotline number. Now, this is a decision folks here at Kodak are celebrating. They're saying it's not only going to save more lives, but it's also going to help with the stigma.
I thought to myself, what took so long?
Dr. Amy Munoz with Kodak Health Recovery and Wellness says changing the number to 3 digits couldn't have come at a better time.
According to the Center for Disease Control, we've seen an increase of 33% in suicides. It's the 10th leading cause of death in the United States currently.
Munoz adds most people aren't embarrassed to call 911 for an emergency, so it should be the same when people call 988 for a mental health emergency. She says the new number will help.
It also reduces the stigma related to accessing care when you're in a mental health crisis. You know, again, equating it to a medical crisis makes it easier to access, and it makes people want to reach out quicker.
The current 11-digit number, 1-800-273-TALK, routes callers to one of 163 crisis centers. Calls made now using 988 would be directed to one of those crisis centers. Counselors answered 2.2 million calls last year.
What's finally happening, it's certainly relieving to me that it's being acknowledged on that higher level and it's being taken seriously.
Her message to those who need help:
sharing those stories and reaching out when you need will help normalize that care, and you would be less reluctant to not reach out if you just were brave enough to reach out.
At this time, the FCC has only proposed requiring all telephone service providers to accommodate that 988 number within an 18-month time frame. The next step, of course, having an open discussion on implementation and setting a time frame for this project. Reporting live in Midtown, Lucelia Caballero, KGUN 9, on your side.